So my name's Dr Harvey Tagger. I'm a consultant clinical psychologist at Solihull, which is the 0 to 19 service in Solihull, and also for early intervention in psychosis in Solihull. As part of the project, there were some core members and different members at different times as well. So we've had Dr Claire Forsyth, who's a principal clinical psychologist at Solihull, Lindsay Murcott, who's a systemic family therapist, and different trainee clinical psychologists and assistant psychologists throughout. So we've had Emily Taylor, Laura Stanford, Snigdha Mukherjee, Annie Sillence, and historically we've had another psychologist, Dr Brad Crook, who's since left the service involved. How the project came about was during the COVID-19 lockdowns and after. There was a lot of focus on well-being at work, and we were starting to consider the impact of having to provide and continue to provide a service through the lockdown periods and dealing with well-being afterwards, and really getting an opportunity for us as a team to think about well-being at work. And the project initially started as a way of helping us promote well-being and thinking about making work feel enjoyable again. And at the same time, we were considering not just improving joy at work, but thinking about what are the factors that affect joy at work. And the tagline was also introduced around increasing joy at work, but also trying to address factors which affect burnout and adversely impact on well-being. And that's where the QI project evolved. So the Solar QI Joy at Work project helpfully gathered more steam as the trust in generally was thinking about QI methodology and supporting different projects. So we've had consistent support from one of the QI facilitators called Deep Singh, and that's been quite instrumental in helping us shape the project, refine the project, but also keep us focused on track as well. And I think without that support, we would either have finished long ago, or it would have looked not as robust as it did when we were completing the project. As QI methodology was new to us in Solar, we were having to get up to speed with PDSAs and regularly trying to introduce and review what we had tried. One of our more successful PDSAs in the Joy at Work project was random acts of kindness. So we noticed that a lot of organisations, when they're thinking about well-being, were focusing on rewards, etc., that we could give to teams, and we were considering that in what's a more practical way of recognising and acknowledging each other. And so the random acts of kindness started off with food. So we got some pastries and different sort of goodie selections that were just placed around with an emphasis on taking time out just to enjoy one of these. And what we noticed is it generated other random acts of kindness from people who were not associated with the project. So suddenly, there'd be a selection of other goodies that were available. And just seeing that pay it forward idea come into play. One of the others that we've attempted as well is a wellbeing hour. So having specific time. What worked about this wellbeing hour was having time set aside where we were explicitly focusing on different tasks, and we tried it during a CPD session where the staff group could either focus on doing a small origami task or desk yoga, or even just having space to have a tea and coffee chat. One of the challenges was this with trying to do this over Teams. So it was at a time when a lot of the workforce was still working from home. But also having sign up from people to engage with the wellbeing hour, especially because it involved taking out time of a busy schedule already, and recognising the importance of that. One of the other PDSAs that we've tried to consider as well is having stay conversations, and this is something we introduced at the end of the project, so it's still an area that we're following through with. There's been a lot of focus on exit interviews for people as they leave the service, but not much interest in the people who have remained in a job, whether it's been for months or years or even decades for some of our staff group. And just recognising the sort of the value of what it is that they hold about their job, that they keep coming to work as well. And those were ideas that we've pinched with pride from other areas. So it's been a great idea of noticing what else is happening in other parts of the country, especially if they've been linked in with QI projects, and pulling in those ideas to see how it works for us. Another PDSA that we've also tried is just recognition and celebration of the staff. So we had anonymous slips around being able to comment on what different people in the team appreciated about another colleague, and then that being able to be shared with them. Which we did more towards the start of the project, but it's been one of those areas that we've not had an opportunity to reintroduce, even though it is quite relatively straightforward to try and do again. What I found enjoyable about the project is working with the team and thinking about an area that's important, regardless of whether it is a QI project or not. I've appreciated people's interest and the different ideas that have come through, and sharing the load, so that different tasks and different PDSAs were set up and followed through by all members of the team, and it feeling like a space where we could all bring ideas. And that's what we noticed when we reflected on the team makeup, that there were some core team members and some people who would be there in a more transient phase because of their time on placement with us was only 6 to 9 months, and therefore they could only be involved for a short period of time. But recognising that everyone who expressed an interest in the project did so because it was of interest to them, and it was nice seeing that in the team. So the next steps for the project was to broaden out these ideas outside of solar. One of the things that we were very keen for was that this is not a unique situation to just us, but also that there's some learning and ideas that could be useful for others. So we've had a session with the let me rephrase that. So one of our next steps has been to hold a Listen Up live event with the Trust as a way of promoting the ideas. And what I was really pleased with was that it generated some conversations with other teams in the Trust who are keen on some ideas. And as a follow-up, there have been study days and away days in other teams where they've invited us in to talk about the project. Not necessarily that they have to lift and shift exactly what we've done, but just to get some ideas around how could this be adapted, and that was done in dementia and frailty as a key example. A different setup to working with children, but I was really reassured to hear people thinking about staff well-being and trying to address areas of burnout. More locally in our service, we've been focusing on how can we address those elements of burnout, and are focusing on demand and capacity and how that accurately reflects what we're able to do, and including job planning for all of the workforce to help manage some of those demands. And I'm keen to see that idea grow and develop outside of the project as well. Yeah, so how you could improve your well-being and happiness in your job is I guess being able to focus and reflect on what it is that you enjoy being at work, what it is that affects well-being at work, are there factors that we can help influence? Are there things that we can help address that might be areas that affect all of us? But being able to share ideas, I think when we feel that we've got some say or some way of helping influence the working culture for the better, automatically helps improve your reason for being in the job that you do, wherever you are and whatever you do.